Welcome everyone to Going Almost Gradeless, how removing grades can deepen student learning experiences. Today we're lucky to have Doctors Jeanne Frenzel, Lisa Richter, and Elizabeth Monson from North Dakota State University here to offer their insight on student retention. These presenters have 3 years of experience implementing alternative assessment strategies in the classroom. Dr. Frenzel is a professor at the School of Pharmacy specializing in teaching complex hospital pharmacy practice skills to students. Her research focuses on innovative pedagogies using alternative assessment, simulation, and technology. Dr. Frenzel received Bachelor of Science in Pharmaceutical Sciences and Microbiology, a Pharm.D degree, and a Ph.D. in Education from North Dakota State University, and has received numerous local and national awards for her contributions to pharmacy education, including multiple teaching honors. Dr. Richter is the Director of Experiential Outreach and Assessment and an Associate Professor of Practice. Her responsibilities include preceptor development, site quality assurances, and assessment of experiential education. Dr. Richter previously spent many years as an APPA acute care preceptor and PGY1 residency program director. She draws upon those experiences when designing novel preceptor development programs. Dr. Monson is an assistant professor of pharmacy practice and clinical pharmacist at Essential Health in Fargo. She provides didactic education to pharmacy students in the areas of neurology, nephrology, and internal medicine, and coordinates the pharmacotherapy capstone course. She utilizes her experience precepting students at Essential Health to provide up-to-date active learning in her teaching. Let's welcome our speakers.
Good morning. Thank you all for being here. My colleagues and I are very excited to share our experiences with you around the areas of ungrading or alternative assessment. And so that's what we'll be discussing today. Our experiences are very similar to what you see in the literature, in that the use of ungrading or alternative assessment strategies have resulted in positive outcomes, most importantly, reduced stress for our students, increased enthusiasm for learning, quality feedback, and more positive interactions between the students and ourselves. We wanted to start with a quick poll. You can either log on to menti.com and input the code or use the QR code. And we just wanted to gauge your interest in the use of ungrading in the classroom. Well, this is our first use of Mentimeter, so I'm not sure if it's updating or not, but we're hopeful that many of you feel ungrading will allow for personalized feedback and it'll help our students, us as faculty, meet their individual needs. So I'm not seeing any changes, so we'll move on. We first explored the idea of ungrading through an NDSU Office of Teaching and Learning sponsored book club. And from there, we joined some on-campus faculty learning communities. We engaged with our pharmacy colleagues, both in formal and informal conversations about ungrading. And we kind of slowly began to incorporate these ideas both into our didactic and skills laboratory courses. And so a big shout out to Danielle and Jenny for their guidance through this whole process. They were a big part of helping us understand the importance and value of these changes in our classroom. Susan Bloom's book, Ungrading: Why Rating Students Undermines Learning and What to Do Instead, really helped us to understand that traditional grading often prioritizes numerical skills over genuine understanding. This really resonated well with me. And it's leading students to focus on earning grades rather than mastering the content. So by moving towards these alternative assessment methods, educators can emphasize the importance of intrinsic motivation, critical thinking, personal growth in our students. This shift encourages students to take ownership of their learning, really engage with the material. We're hopeful that that's happening, and develop skills that are really valuable beyond the classroom. So ultimately, this big shift in thinking can create a more supportive and effective educational environment, better preparing our students for those real life challenges. So the course Pharmacy Practice Laboratory, that is my course. It's a 1-semester skills laboratory course focused on building our second-year students' skills in hospital pharmacy practices. And during the 2020-21 year, I'll consider those students my cohort 1. They had their traditional educational experience. They had 50 minutes of in-class experience, 50 minutes of skill building in our laboratory, 50 minutes of online work. They used traditional worksheets, study guides, all of which I was reading and turning back, team-based projects, summative performance-based exams. So they earned a large number of points. And if they weren't turning in assignments or they missed a a class period, it really wasn't detrimental to their overall grade. They had an abundance of those total points. And so the feedback was really limited to these weekly graded assignments. So maybe you get a 9 out of 10 and you moved on, and that there was nothing more to it than that. Final letter grades were assigned on a 90, 80, 70% scale, and there was no remediation for the course. For my cohorts 2 and 3 in the years 2021 and 22 and 22-23 respectively, the schedule of the course remained, but I did make some significant changes in order to shift that student focus from points earning to learning. Alternative grading strategies I used included revise and resubmit assignments, a learning portfolio, formative feedback, and reflection. Of course, the university does require a final grade, so I couldn't go completely ungraded in my course. But in this new feedback format, feedback really became centric to how the course was running. So the first major change to the course was the addition of student self-assessment and instructor real-time feedback following compounded sterile preparation practice. So the picture on the far left are our students all garbed up and practicing in our simulated compounding area. So for this particular skill, they have to learn how to use aseptic technique. They'll be washing hands, garbing up from head to toe, choosing their supplies to make an intravenous medication, moving from room to room. There are different criteria to be able to do that, and then compounding in a laminar airflow workbench and creating a final product. In the past, the students would compound, they would leave. I would take their product, grade it with a rubric that give them a score, turn that back. The following week, they may or may not look at it, and they really didn't learn much from that. It wasn't meaningful feedback. In the implementation of the new course, the faculty member, myself, or a co-faculty would be at the hood side, giving them instantaneous, immediate feedback on their compounding process, things that they could improve. This is the first time they were learning the skill, or things that perhaps they wanted to think about or consider as they were compounding subsequent weeks. And before they would leave, they would do some self-assessment, which I think is pretty rare in the classroom. So they would take a moment and they'd either leave a sticky note or a magnet. We upgraded our technology there. And they would kind of think about how they compounded for the week. And they could choose, I could not demonstrate compounding at a level 1. I needed frequent feedback during compounding, a level 2. I needed limited feedback while compounding at a level 3 or level 4. I can compound independently. And these are based on our pharmacy and trustable professional activities, which are discrete kind of job duties that a student should be independently able to complete once they move into practice. And so we felt that this was a good readiness piece for the student to be thinking about as they were moving forward. The feedback was interesting in that they self-inflated in their confidence at the beginning of the skill as they were learning to do it. And then that slowly kind of normalized, and we'd see them at the level that we would expect as they're moving throughout their weeks of compounding. But this also really gave me an instant visual to see how the students felt about their performance and their results. And then I could use these results. I would take this right into lecture. We would discuss about it, and then we could talk about what we needed to do to improve our work in the following laboratories. Beyond the skill development, the course used a revise and resubmit approach to multiple attempt assignments, creation of a peer-reviewed learning portfolio, and a final self-reflection. So the learning portfolio really took place of a lot of those worksheets or study guides that I was having them turn in and turn back. But there, of course, there were a few assignments that I felt I needed to keep to make sure that they had some competence in different areas, for example, calculations, which is really important in the profession of pharmacy. So these assignments were built into our learning management system, and they were set up so that multiple attempts were encouraged, and the student needed to achieve a 90% or greater in order to move on. And I kind of made the assumption that if they were able to do that, then I felt confident that they had the information they needed to be competent in that skill set. If they weren't able to achieve that 90% or they chose not to do the assignment, then I did ask them to come back at the end of the semester to take a comprehensive exam. Very few students took that exam at the end of the semester. The beauty of this is the learning management system takes care of all the grading, which frees up a lot of my time to be more engaged with the students and to give them that really important feedback. The second major change was the addition of a student learning portfolio in place, again, of those study guides and worksheets. So this allowed the students to develop their own learning based on their interests and the time they had available. So to create the portfolio, they chose 3 projects from a menu of 5, and then they were able to create a portfolio that was diverse. It included readings, weekly reflections, video production, and podcasting. And all the projects had a reflective component, which I think was really important. As I read those, then I could make some observations. So I found that the students who chose the annotated bibliographies and the reflections either from the hospital text or from the pharmacist guidelines, which are nationally published. Those students really wanted to just learn more. They were in their workspaces, they were interning, they were hearing terminology like non-formulary medication, and they didn't really understood what it meant. And so they were using these readings to really fill in the blanks. I thought that was really fantastic. Students who are interning in our community pharmacies have a different experience than students interning in our hospital pharmacies. And so they were using the readings to kind of get a better understanding of the different types of practices. So really neat outcomes just from simple readings. Those students that chose to write the weekly reflections, those were interesting in that the students really recognized when they were struggling with this skill, and then they self-offered solutions to overcome, or though they would refer back to previous experiences. And you could actually see them developing in their skill set throughout the semester. And then we had students that chose to create videos or the podcasts. They felt that as they went back to rewatch these or listen to them, they really helped them in the end of the semester performance-based exam. So it was increasing their competency in those ways as well. I did bring
The first part of the suite that we're going to look at here is the anteroom. It's ISO class 7 or 8. This is where hand hygiene and garbing is performed and supplies are gathered. The next area is the buffer area. The ISO class 7, it's where the primary engineering control is located. Supplies are prepared for compounding. We monitor and control airborne particles. The third and final part of the compounding suite is the primary engineering control. It's ISO class 5. It's where the exposure of critical sites when compounding happens. There are 3 different types of primary engineering control: the laminar airflow workbench, the biological safety cabinet, and the compounding aseptic isolator.
So in this example, this is a portfolio project where the students chose to explain to me how the compounding suite works. And you can see it's a little complicated. There are different types of rooms, different types of airflow. But through the student's narration, I could tell immediately that she had a good understanding of how all of this worked. And much more fun to watch one of these versus a worksheet where they're filling in the blank or doing some multiple choice work. In the next example, we'll just watch a brief clip of it. I have the students using common household items to explain how they would aseptically prepare a product. And these are a blast to watch, probably my most favorite project. And again, through their narration, it's very evident that they have a good understanding of aseptic technique. They know how they would compound, and I feel really confident that they would be competent when they go out into practice or on their 4th year rotations.
First thing we're going to do is compound a small volume bag. By small volume, meaning 100 mils or less. So we have our 100 milliliter bag, we wipe it down, we put in with the port facing the filter. But since I have no hook, I would hang it like this if I had a hook. But I do not have a hook, so I'm gonna lay it like this so the filter air can hit the port. Next thing we do is wipe this down and put it in. And put it into the hood, sterilized, spaced out. And we grab our needle too with the syringe, and you wipe this off and put it in. Make sure they're evenly spaced out so the air does not hit, and so air moves evenly to each other, and so each thing gets enough air so it does not get contaminated. Because if you block,
I just love that. And again, it's really like the amount of detail he put into that assignment. I knew right away he understood, he'd been practicing, and it all made sense. And not all videos are that great. And so you get lots of different submissions, and the creativity too is pretty fantastic. They come up with all sorts of household goods that they can make their videos with. When analyzing the results for my cohorts, cohort 1, 2, and 3, we did have statistically significant changes in both knowledge and confidence. However, I would tell you that the alternative assessment cohort, so they all kind of came out the same, but those that started with the alternative assessment came in at a lower knowledge level and ended at a higher knowledge level. And so that's our best evidence that hopefully this is working for us, and students are demonstrating some excellent changes in both knowledge and confidence. So my findings really hopefully indicated that transitioning from traditional to an alternative grading strategy resulted in similar or higher learning outputs, significant increases in our student confidence, and transitioning from a rigid point-based grading system to a more flexible course structure really encouraged that personalized learning. They were learning about things they wanted to know more about, and skill development through feedback and reflection. So I was reading all of those reflections. I was giving them feedback on it. Sometimes in certain courses, I would have them swap portfolios and they would get peer feedback, and they were always able to revise and resubmit that so they had a better final product. They were also able to pace this coursework independently, refine their work, and we really created a constructive feedback loop that facilitated the development of their hospital-focused pharmacy knowledge. We also, the three of us, collectively sent out an anonymous electronic survey to our students at the end of our 2022 academic year, just to get some perceptions from our students as to how they felt ungrading was going for them. Within that survey, they did select which course they were responding towards, and they responded only to questions associated with the course and some overall general questions as well. I only had a very small subset of my students enrolled in the laboratory participate in the survey, but a majority of the students both agreed or strongly agreed that they preferred the real-time feedback versus a rubric. When learning how to compound a sterile product, the self-assessment really helped them gauge their improvement week to week and their development in this skill. The assignments with the unlimited attempts helped to understand the course content, and compared to the other graded laboratories that we have, the ungraded better supported how they learned the course material. It reduced stress associated with points and grades. And I will tell you that one of the biggest takeaways, as soon as we implemented the ungrading in the laboratory, the stress levels came way down. It was almost palpable. The questions came way up. They were willing to ask more about their skill development and learn more at a higher level. They were taking more risks with their learning. And so we felt that overall it was an extremely positive experience.
So I teach in pharmacotherapy capstone, which is a required course that is offered in the final semester or final didactic semester of the pharmacy curriculum. So prior to students going on rotation. And so this course traditionally is not a course that teaches new skills, but rather takes all the materials they've learned in prior semesters and combines them into integrated patient case scenarios. And so students are tasked with collecting information from an electronic health record, and then they have to make an assessment and a plan for that patient. And they would, prior to ungrading or implementing our ungrading, they would turn in their cases into Blackboard, and then we would talk about it in class. So we would have small group and large group discussion, and then afterwards we would select 4 cases throughout the semester that were graded by faculty. And so you can imagine that this grading took a lot of time, and students had to really continue to work on their cases without getting feedback early on in the semester. So after going through the book club and all of our discussions, I decided to implement ungrading into this class. And so the ungrading strategies that I implemented, I'll go through them in more detail, but I implemented some earlier assessment strategies. I also did allowed case revisions. And then I used a specific rubric grading that allowed for more feedback. And I added peer feedback, so they would get more feedback than just the 4 homeworks and 4 assessments. And I also added a end of course reflection. So if you think back to courses you teach or classes you have taken before, often classes have a mid-exam and a final exam, or maybe 2 papers. And so students really don't learn how they're doing in the course until later in the semester. And so one of the key takeaway points that I got from ungrading is allowing students really to fail early on so that they would learn what they need to do to succeed. So I really implemented that as soon as possible. So day 1, I did the traditional go through the syllabus, explained why do we do ungrading? Why is it so important that I am focusing on feedback? And then day 2, they had to take their first assessment in class. And as you can see in what I posted here on the right of this slide, I explain why I'm doing this. What are the students learning? So they are really learning the format of how these exams will be. They're learning what they're going to need to do to prepare to do well. And then day 3, we will walk through that assessment together, and they will learn what is it that I am looking at. They will learn how to give feedback to each other. And so they really are told right away, this is what the expectations are. They experience it firsthand, and then they know what they need to do for the rest of the semester. Homework case revisions was the other implementation that I did. So students complete approximately 20 homework cases throughout the semester. And so now they are able to prepare the case ahead of time. We come into class, we discuss in a small group format at first, and I maybe prompt them to talk about something specific. And then we have large group discussion, and then they are encouraged to go back and make changes to their cases. And the idea is that hopefully they're going to get full points on all of these cases because they're learning, and all of this is going to help them on their assessments. So then the course is broken into 4 blocks, and at the end of the block, one of the cases will be selected to turn in. So they won't know which one, which is why they're also encouraged to really improve on all cases, but only one will get graded. This is the rubric grading that I use. It's There are 5 grading criteria. This is an example of one. The first grading criteria: compile a prioritized health-related problem list for a patient. And I have 3 levels. And this is really to bridge them into practice because this is how they will be graded on their rotations. And you can see I am very clear about what I am looking for. But also then this allows me to easily grade and instead provide more feedback. So the focus is more on the feedback that will help them in the future. In addition, students do peer feedback. So 4 additional homework cases are selected and they are automatically assigned in Blackboard in our system, and they give feedback to each other. And these are the prompts that they are given, and they get points for giving this feedback to each other. And I don't grade what their feedback is, but I encourage them to give valuable feedback to help each other. And from this, they're able to see what other students are doing. So they kind of get an idea of maybe if there's any changes they want to make in their own homework. And so it's another avenue for them to get more feedback that doesn't take my time as an instructor. And then finally, at the end, I do a final, I call it a self-assessment or a reflection. And I ask them to fill out these 5 prompts where they get to evaluate how much growth they made throughout the semester. Did they actually meet all of the course objectives? And I ask them to provide feedback or to provide examples exactly of what they have done. And at the very last question that I asked is, what is one piece of advice you would give a student who is taking this next year? And it's interesting, I just graded all of these, and a lot of students say a lot of the same things that I tell them at the beginning of the semester, like, the amount of work you put into the course is what you're going to get out of it. And so I turn that around to them and I say, think about applying that to yourself when you're going on rotations now. So that's kind of a cool takeaway from this. Here is an example, or here are what the students said. So I had 67 students answer for capstone. As you can see, a lot of students agreed or strongly agreed that they really felt this ungrading helps them learn the content. It reduce their stress, and it helped them prepare for API rotations.
Okay. And then our final pharmacy class that I wanted to talk to you about is Pharm.70. It's a pharmacy practice improvement project management course. It's a 3rd-year pharmacy course that they take right before they go out on their experiential rotations. Similar to the other 2 courses, we used a portfolio of options that students could choose from. We did peer feedback. We did a final self-reflection. But one thing that was different about this course is we didn't do any grades, or any points. So no points at all in the course. So more of competency-based grading. So in this, all assignments were mapped to course objectives. The assignments then were either meets or don't meet expectations. They were able to redo some of the assignments. And then students were awarded a grade based on the number of course objectives that they met. So what this looks like is I had 6 objectives for the course, and then those were matched not only to our ability-based outcomes in the pharmacy program, but also to the different assignments that students would complete, so they would know what pieces were going to show evidence that they were meeting those objectives. Then all the assignments had a rubric which explained what meets expectations look like versus what doesn't meet expectations looks like. And then those were mapped to the course objectives as well. So students would know which course objective, again, this was showing evidence of meeting or not meeting. And then the final grade was based on the number of course objectives that the student met. And so if they met 5 or 6 objectives, they would get an A, and then down the line. In this course, the students do a longitudinal semester-long group research project. And so based on that, these are some of the different projects that they did. But rather than assigning points for these things, certainly I know as researchers, when I'm working on research proposals and submitting to IRB, I'm getting feedback from other individuals. I'm not getting a grade. My supervisor or the IRB office isn't grading my proposal. And so it felt more authentic to give feedback and revise versus assigning points for these types of assignments. And then these are the types of things students were able to accomplish in the class. We did that same survey of students. We had 59 that completed the survey. And so they had very positive things to say about the ungrading, that it helped prepare them for their rotations, where again, they're going to be graded not on letter grades, but more of a pass-fail scale, and that it decreased their stress. We also surveyed faculty in the former College of Health Professions. And so in our whole college, just to get a little feel about how they felt about ungrading and alternative assessment. And so they disagreed with the statement that getting a good grade means that the student will remember the content 1 year from now. They agreed that students are in general too concerned with what grade they receive and not what they actually learn.
And then they were neutral on preferring evaluating an assignment that did not require an assigned grade, but rather provided feedback for the students. We sent that same survey to our pharmacy students. And so they also disagreed or were neutral on that getting a good grade meant that they will remember the content 1 year from now. They were actually even more strongly agreeing that students were too concerned about getting good grades and less concerned about what they were learning. And then also agreed that they would rather have an assignment that got feedback versus a grade. So with that, I think we are almost near time. And so we'll probably just pause here for questions, give you the opportunity to think about if there are some assignments in your courses that maybe you could do some alternative grading. And we're happy to take questions that you guys might have at this point.
I've done ungrading or alternative assessments in a lot of my classes. And for the most part, I'm getting similar kind of responses from students, really, really positive, lowering stress, those kind of things. However, I have a population of students that fall in the neurodivergent category that are used to being successful in a certain way in classes, and they are really thrown for a loop in these alternative grading assessments. And I'm wondering if you're encountering that at all, and if so, how are you dealing with it?
Yeah, that's a great question. I don't know that I have any great answers for that. Certainly, yes, certainly not everybody agrees with all of these. And there are some students that are like, how are you changing this for me now when I'm in my last semester of didactic curriculum as a pharmacy student? And so, yes, certainly it's not all positive, and there is a range of responses. I don't know if you guys have any other thoughts on.
Find that in my capstone course, the neurodivergent students, they really thrive after experiencing that first assessment and realizing that. And then they actually really take advantage of the in-class discussion time to improve. So I find that interesting, I guess. So something about that kind of triggers to prepare more.
You did these assessments with the faculty, with the students. Have you done these same assessments with employers? That is, specifically, are students coming out with the skills they need?
Yeah, that's a great question. That would be a great research project that we have not done yet. But I would say when they're out on their rotations, that's the way that they're graded, is very similar to this kind of competency based where they meet expectations or don't meet expectations. And we actually just had, at least for like our residency programs in the area, we had a higher than the national average rate for matches, which has been what we've been done in the past. So we haven't seen any signs of that necessarily getting worse. Yeah, but that's a great question that would be good to investigate.
How do you manage the feedback in the moment? Is that sort of like in front of a lot of students or just to one student? How do you sort of take the time to do that to make sure it's hitting for the other people?
I would say at least in my class, the students work in groups, like in groups of 5 or 6. So I'll usually give feedback to the whole group at the same time because they'll be working on a project in class. And so a lot of that times it is in the moment, but it's to the whole group that's working on it. Jeanne, I don't know if you have thoughts on in your lab, probably you do the most in-person feedback.
Yeah, ours is usually one-on-one, and then, there's a degree of anonymity probably when they're garbed up. And so they're garbed up and they're focused into a hood, and I'm usually just right beside them and I'm kind of telling them. And I don't think the other students can necessarily hear because of the next to them. But then when they're moving their product back from the, we call the clean room to the buffer room, we're meeting them and we're checking just like a pharmacist would in practice. And we're going through and we're saying, oh, your syringe wasn't pulled back to 10 or those types of things. But it's kind of feedback that you would expect to hear. And so I think that's good for everyone to hear, but there's usually a small group of students kind of in that area as that's happening.